All right, welcome everyone to another educational webinar through EBFA/Naboso, where we are going to be focusing on fascial-based movement, specifically as it relates to walking. Now, my name is Dr. Emily Splichal. If you have not taken anything with me before, it is a pleasure to meet you. I am the CEO and founder of Naboso. And in addition to that, I am a functional podiatrist, human movement specialist. I do see patients. So if you are interested in what you're hearing, maybe some chronic foot pain, just know that I do see patients virtually. Most of my patients are virtual. I've created a lot of education through my education company that was just acquired by Naboso. So big things coming for Naboso in 2026, specifically as it relates to education and content and empowering you through knowledge. So stay tuned for that. Check out any of the books that I've written, and then of course Naboso. Here we go. That's my intro. We are jumping on into it. So our considerations for this topic is it's all around walking. It's all about how we were designed to be efficient beings. Our system, our myofascial system, our energetic system is based around our ability to be efficient movers. And when I say efficient movers, it is, again, particularly around walking, because that is the most foundational functional movement that we do every day. It was for years, many, many years ago, but for years, it was a means of transportation. Locomotion was we walked to get from point A to point B. No driving was at that time. So walking is supposed to be accurate and efficient. Accuracy is another topic that I love to focus on, but here we are going to be focusing on efficiency, okay? This efficiency, functional movement efficiency is going to be linked to gravity and energetics. We'll go into all of this and what it means, okay? Now, this is based off of understanding the basics of a walking pattern, meaning the phases of gait. Now, we do have a mix of what you could say professional and consumer. That's how I think of it from a Naboso mindset, but from a professional or a patient or professional lay person, right? So we have a mix of that in attendance listening to this topic. So I do want you to know, even if I go into the different phases of how we walk, I'm still speaking to you. I'm not speaking to the professional. I'm speaking to you. I want you to understand how and why we walk the way that we do, and that it is truly designed to be efficient, right? So when we understand that gait cycle, we understand the demands of each phase and how we can optimize it to support my third favorite concept or words, which is movement longevity. Because ultimately, we want to move accurately and efficiently so we can move well for a very long time. That's your movement longevity. Okay. Now, to start this off and kick into each of these different points, we were designed, our nervous system, our skeletal system, our myofascial system was designed to be upright. So we were all designed to stand on our 2 feet. Our 2 feet planted on the ground. The only contact point between the body and the ground is the feet, specifically the skin in the bottom of the feet, but the tripod of the feet. Our toes play a very important role in that balance and that ambulation. And then it goes up to our center of mass, which is going to be our pelvis. And the human has a very unique pelvis, a pelvis that is optimized for upright stance and for walking. So it is innate within our design to be up on our 2 feet and ambulating. Very important takeaway. And then the art of walking. The art of walking starts with or is centered around understanding energetics. And energetics, if this is a new word for you, this is all about where do we get the energy to walk across the room, right? So this energy transfer. Okay. Now, oftentimes we think about energy coming from like our food, right? That's calories. Calories is a form of a work or an energy, right? You can kind of put it in a caloric energy association. However, when we talk about movement and walking and things like that, we don't want to be generating our own energy. We are trying to utilize the energy that we are given from gravity. And gravity is one of the most important sensorial stimulation that we experience every day. It is a downward pressure on our shoulders. So we, of course, relate to it in our body. We push up to it when we stand. When we move our arm, we are moving through a sea of gravity, right? It's creating body awareness. It acts like a hug. It tells us where our body is in space. All of that is a gravitational story. But what I want to focus on here, even more so, because this has to do with the energetics, energy transfer energetics, is really around the foot. How does our foot relate to gravity? And the way that our foot relates to gravity is in the form of impact forces. Impact forces and ground reaction forces are created from gravity. And what's happening is that your leg is swinging forward, your foot is about to contact the ground. And because there's this downward pressure, you actually get an acceleration and a free fall of your foot striking the ground. Boom, you hit the surface, you create these impact forces. Those impact forces are gravity, and that's what I want you to understand. And then those gravity, ground reaction force, gravity stimuli is going to be energy. And right now, we are going to call it potential energy. Potential energy, which is the optional energy. If you remember from physics, you have potential energy, which is ultimately transferred into what's called elastic energy, just to kind of tease you ahead. This is kinetic energy, right? Energy transfer through your system, but really foot, strike, ground, impact, force, energy. Boom. That's where I want you to hold it right now. Okay. Because knowing and appreciating that we have this critical relationship with the ground is important to how you optimize your art of walking, right? If we forget or disconnect or disassociate from this foot ground relationship, you are then moving in an inefficient way. You are not moving in this art of walking that we are talking about. So we have to have a connection to the ground, to gravity, and to ground reaction forces. Okay. Now, if we go to the gait cycle, this is our walking gait cycle. I'm going to do this high level. So if you're thinking you're going to be a master of gait after this lecture, you will not be. I apologize. You will have to continue through the journey of the EBFA and Naboso education, but this starts to get you familiar with these different phases. And then I use this with my patients. I will actually say during the gait cycle, mind you, they won't probably use the exact word, but I will say, walk for me, and I need you to tell me every time you feel it, say here, 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 so I can see exactly which phase of gait is triggering the symptom for the client or for the patient. Now, when it comes to gait and walking, there's a couple different ways that we can think about it. Some of these have actually shifted. There's actually a inverted pendulum model. There is a double pendulum model. But I just want you to start to think about these different models of our system when we are walking and running, and just how does our body utilize it, okay? One thing that is very interesting when it comes to walking is that as we walk and we strike the ground, your leg is in front of you and you strike the ground and then you shift into what's called a single leg stance. So foot strike, shift forward. Now you're balancing on one leg, if you could imagine that. As you do that, your center of mass is actually rising. And then your swing leg comes through and you step again. And as you step through, you get this momentary drop in your center of mass, and then it rises again. So we get this little wave like this of your center of mass. Okay. When you are in what's called mid stance, which is the position when you are fully on one leg, I'll show you that. I'm going to go forward just so everyone is super clear. So right here. So when you're here in mid stance, your center of gravity is actually its highest during the gait cycle. So you are super, super stacked and stable, and your center of mass is high. Okay. Now take this and you compare it to running. When we run, imagine you're running, and running is a single leg activity. It's fully 100% single leg, and then you have flight time and then single leg. When you're on your single leg and you land into the ground, you're actually compressing, kind of like this spring. So you're running, you're going to compress your system, and then you're going to release it and spring forward. So imagine someone running, okay? That in a running gait cycle, your center of mass is actually its lowest when you are fully on one leg. But when we walk, your center of mass is its highest. Okay? The reason why I say this is that I try to tell people that running is not just fast walking. The mechanics switch, and this is not centered around foot strike patterns and heel strike versus mid-foot strike running. That's a different topic, which I'm happy to do in the future. But I just want you to know that right now, what we are talking about is mechanically walking, because the energetics and the myofascial demands of walking are different than running. Similar, but different, okay? So we're going to be focusing on the walking and the foot strike pattern of walking, which is different. The way that our center of mass rises when we walk, which is different than when we run, okay? So just take them a little bit separate, if you don't mind. Okay, so let's get into our walking gait. Now, when we walk, you have two legs, so therefore you have two phases of gait, two main phases of gait. Your legs are doing different things. One phase is in stance phase, one leg is in stance phase, the other leg is in swing phase. Okay, now, despite these two phases, you spend a majority of your time in stance phase. Stance phase is when you are in contact with the ground. Okay. We see a majority of injuries walking and technically running, but right now we're talking about walking. Walking injuries when we are on the ground. So that's important. Where the system starts to get overloaded or we see an inefficiency, is during the stance phase. So that's, as from a clinician standpoint, that's the main phase that you should be looking at, is the stance phase. Okay. Now, when we look at that, this is how we're going to break it down. You got initial contact, loading response, mid stance, late mid stance, propulsion. There is no exam after this webinar, so guess what? Don't worry about it. But we are walking, we're swinging that leg through, your foot contacts the ground. As soon as it contacts the ground, very rapidly, almost simultaneously, do you transition into the load-in response. You then shift all of your body weight into a single leg, just like the center picture. That is called mid-stance. Your center of gravity is rising, and then you start to swing your leg forward over your center of mass. You can see the white leg is swinging forward. That's going to start to tilt you into your ankle, which is back here. And then that leg goes so far forward that now it rocks you forward onto your toes, and you're ready to swing that leg through and start this whole process over. Okay, that is essentially what's happening. And from an energetic standpoint, what we want to think about is, how does this foot contact right here, all the way on the left, strike ground, ground reaction forces, gravity, potential energy? How does your body take the potential energy from this phase, and what does it do all the way to this phase, so that you can release the energy during propulsion and swing that leg forward to then repeat it again? Okay. If you can master that, you will then have mastered the art of walking. And when we say the art of walking, it means walking efficiently. Okay. So, and again, here, when you are moving efficiently, you have minimal stress to the system. And that's what we're looking at. Can you have as minimal stress to the system as possible so that you don't get injured, so that you don't overload tissue, you don't get plantar fasciitis, Achilles tendonitis, shin splints, whatever it is. Okay, here we go. Here's our initial contact. This is where we are striking the outside of your heel. So yes, you strike the ground on the outside of your heel. So the back outside of your heel. If you looked at any of your shoes, you would be able to see that the wear pattern of most shoes is on the outside lateral, outside aspect of the shoe. That is how we are supposed to contact the ground. Technically, that is called an inverted position. So you're striking the ground inverted, and then you're going to quickly roll through loading response, which is your next phase, and absorb that potential energy. Okay. Now, what I do want to call out here, it will make more sense as we go through the rest of the journey, but right here, this peak here, this force curve is showing initial contact, which is right here, and then this one way up here is going to be propulsion. Okay. This right here is your body weight time. Right here, when you strike the ground, you are going to experience 1 to 1.5 times your body weight. For the sake of what I'm going to explain right now, we're just going to say 1.25. Okay, so you got 1.25 times your body weight, boom, when you strike the outside of your heel on the ground. Your body is going to very rapidly absorb it. And then as you go through the rest of the gait cycle, we'll talk about that. But now you're in the propulsion phase. You're on the ball of your foot and you're about to take a step. You are actually releasing, look how that doubled. This is 1.25 times your body weight. This is 2.5 times your body weight. Do you see that doubling response that is in there? So from here to here, boo, right? So that is a great demonstration of movement efficiency. So when I do these on patients and I look and I'm looking at initial contact to propulsion, does that patient have the capacity to double the amount of potential energy that was in? So when you go from potential energy, this is going to be called elastic energy. Can you double the potential to 2x elastic? If you can, you, my friend, are an efficient mover. Okay. This is how we want to start to think about it. So here we go. This is essentially what I had said, 1 to 1.5 times your body weight at initial contact. Now, as your foot strikes the ground, boom, foot contact. What you are experiencing is, yes, ground reaction forces, but the way that you actually perceive ground reaction forces is as vibration. So you are perceiving it as vibrations, okay? These vibrations are going to be perceived by the nerves in the bottom of your feet. There's very special nerves in the bottom of your feet. Right here, you can see it. Meissner corpuscles, Pacinian corpuscles. Both of these nerves in the bottom of your feet are sensitive to vibration, okay? So our feet, the skin in our feet was designed to feel the stimulation of the ground, which is vibration. Okay, this is important because the vibration is your body's potential energy. To absorb the potential energy, you have to be able to feel it, to perceive it. If you cannot perceive it, you will not accurately absorb it. If you do not accurately absorb it, how are you going to 2x it, right? This is where the topic of cushioned in shoes comes in. So theoretically, you could say, well, can someone move as efficiently in thick cushioned shoes as they do in, say, a minimal shoe? I mean, that's where the argument could be. Maybe not. Maybe not so the same because of the lack of perception of the vibration stimuli, right? That's how we kind of want to start to think about this, okay? So the way that we are connecting to the vibration that's going through our body, the vibration of ground reaction forces going through that body is partly the skin in the bottom of the feet, and then partly because we are our whole system, your fascia, your connective tissue. So this myofascial connective tissue web has millions of nerves. There are over 100 million sensory nerves in your myofascial web. Okay? This is a sensory experience. For someone to move efficiently, and again, just so I have it very clear, the art of walking is based around efficiency. That's, I think, well established. The art of walking and efficiency is based off of a relationship with gravity and the ability to perceive, store, and convert the energy from potential to elastic and to exit every time you take a step. That's ultimately what we're talking about. And that, my friends, is a fascial-based response. Okay, that is a myofascial-based response. So your fascia is very important to the way that we are feeling, perceiving, and then here, absorbing the potential energy that we are getting from the ground. Okay, so if we were to go into the next phase, which is loading response, the question is, how do we damp or absorb the potential energy of impact, right? How do we damp the vibration? How do we absorb the potential energy from the ground, right? So what is that relationship so that we can optimize that, okay? The way that we absorb the vibrations, damp the vibrations, store the potential energy is going to be through our muscles. And I'm going to say, if you know this, please just humor me for a moment. But oftentimes when I teach this and share this or explain it, is I talk about a tuning fork. And I'm at my house, so I apologize, I don't have a tuning fork, but let's have a tuning fork. And I strike the tuning fork, and the tuning fork is vibrating, right? How do you stop the tuning fork from vibrating? You're going to touch it, right? So that touching of the tuning fork that's vibrating, you are essentially clenching, right? You're contracting to stop the vibration of the tuning fork. So contract. What contracts? Your muscles contract. So we're going to contract our muscles, okay? And they're going to contract isometrically. So these isometric contractions create a stiffening response in the body, and that is how you absorb the potential energy from the ground. This happens to be called the muscle tuning theory by Dr. Ben O'Nig. So please explore that if you would like. I do also have additional lectures and videos on YouTube around muscle tuning theory. So please check that out if you would like. Just Google muscle tuning theory and then my last name, and you will get those. Okay, so when we contract our muscles isometrically, if we even do that now, so right now I'm going to engage my core. So I'm engaging my transverse abdominals, or if my arms are out to the side and I'm going to imagine touching the wall, right? So I'm reaching so I can touch the wall. That's essentially an isometric contraction, right? What do I feel in my system? If you're joining me, what do you feel in your system? I feel tension. I feel stability, strength, and technically pressure is part of it as well. But what we're doing is we are describing fascial-based words. Isometric contractions create a tensegrity response in the system so that we can absorb the potential energy from the ground and store it within our fascia. Okay? So again, you can start to see this fascial story is going to compound through the last three phases. Now we've transitioned into our full mid stance. We are now in a full single leg stance. And as we transition forward, what happens is that our leg, our swing leg is very, very heavy. So it's going to tilt our hips to the side. You can see right here in the photo, right? This person is picking up their left leg to swing it through. And as they do that, the hip drops down to the left. That is going to stretch the glute med. The glute med is going to contract and pull the pelvis back flat. And then you're going to swing the leg through, right? So that slight drop of the pelvis is going to stretch or potentiate the glute med, which happens to be part of your lateral fascial line. So that's going to connect all the way down to your feet, that lateral line. Your lateral line is inclusive of your IT band. Your IT band, the role of the IT band is to stabilize the knee in a single leg stance. And that's essentially what we're transitioning into here. So again, that is a really important fascial line activation. In addition to that, this is where we need peak foot to core stability. So your feet are talking to your pelvis and you are nice and stable so you can balance on that one leg. That is another fascial line that is called your deep front fascial line. That deep front fascial line is really going to connect the base of your body, your foundation, to your center of gravity or your center of mass. So foundation to center of gravity. Okay, so they are going to be connected through this fascial line. And why it is so important that we have a fascial connection and an awareness of our center of gravity is because this is a gravitational story, right? We need to understand how to navigate this canister, this physical canister that we're moving around. Where is the center of mass, right? That's how we control better, as we stay really tight and connected to our center of mass. And that's essentially your feet doing that. Okay. So how we stabilize our center of mass is based off of really connecting to where it is. And our center of gravity or center of mass is L5S1. It's actually in front of your system. It's in front of your pelvis. Okay. But it sits around here. It's kind of boop, right here. Okay. So the muscles here that are blending and creating stability of your pelvis so that you can transfer and stand on one leg stable is a story of your deep hip rotators. Your deep hip rotators act like a suction. They draw in your femur into the socket, creating stability. And then they spider web under into your pelvic floor. And then they go on top to your diaphragm. And then coming off of your diaphragm is your iliopsoas. Your iliopsoas is critical to the elasticity of human gait. So we have to be able to have that iliopsoas as we bring that leg forward in swing phase. And then technically your diaphragm runs up your neck to your tongue. So long, long, long fascial line. Here's your iliopsoas in front of your hip joint. And then all of these myofascial connections go right back down to your foot via your deep front line. As your deep front line, this is essentially just breaking it down a little bit, is again a fascial connection. So the fascial stability, efficiency side of walking requires this foot to core stabilization, which is fascial, right? So already we have fascia that is playing a role in perceiving the impact forces. We have fascia that is connecting and triggering that lateral line for single leg stability. We have a fascial line that is connecting our feet to our core, to our diaphragm, so that we are super stable and balanced. We ultimately are going to move like a rubber band. That's that 2x of potential energy to kinetic or to elastic energy, that 2x of it, that's a fascial response. Okay, so we have that, right? So all of this is connecting really through that foot to core, glute stabilization. Okay, and then of course your foot is feeling the vibration from the ground, which is why we need to get out of these thick cushioned shoes. Okay. So this is what we're talking about. Here's your lateral line, okay? Just making sure that we are all essentially kind of covered here. We're almost done, you guys. We're almost done with that gait cycle. You almost took one step. So now we're getting into late mid stance. Late mid stance is going to go back into a fascial story, but this time we are talking about your Achilles tendon. Your Achilles tendon, which is connective tissue, right? A little bit different composition compared to some of the other fascia in our system. But your Achilles tendon, largest, strongest tendon in the human body. This is where we get most of our elastic recoil is coming from the Achilles tendon. As we go through late mid stance and that leg is behind us and the heel is on the floor, you're essentially stretching your Achilles tendon. You are potentiating it. When we stretch, potentiate, you're getting it ready to be recoiled forward and you're releasing that energy. As that Achilles tendon is essentially being potentiated, your soleus and gastroc are going to be sitting there isometrically in their contraction so that you can get that peak potential energy to the Achilles tendon. As soon as you transition forward into that propulsive phase, now you're starting to release the potential energy of the Achilles tendon. That's a fascial response that has to do with efficiency. A lot of research will compare the human Achilles tendon to a kangaroo, and that's how a kangaroo moves efficiently. I love that example. And then propulsion, we are essentially shifting forward, and this is where we are getting that peak elastic release during that propulsive phase. You're rolling through. Of course, you have to have sufficient range of motion in your big toe. That's a little bit outside the range of motion, or the range of motion, the topic for today. But big toe range of motion is a critical part of this whole movement efficiency story as well, right? If you cannot roll through your big toe, you're going to compensate and you're not going to be able to get that full release of energy. So in this position, this is where we're starting to release all of that energy and that elastic energy. Right here is how you get through what's called the lever. This requires sufficient range of motion in your toes. So we can see that range of motion in the big toe. Your rear foot is technically stabilized. Right here is your plantar fascia, which is being potentiated by bending the toes back. That's called the windlass mechanism. That is another fascial-based response for movement efficiency. So all of this here is happening as we go into that final phase. Okay, so what does it look like to move efficiently? What does it look like, let's say, on a force graph? Well, I already showed you that. I'll show you it again, right? But if I were to identify someone moving efficiently, there would be a lightness to their step. There would be kind of a rhythm to their gait. There would be an ease, a grace. I wouldn't hear it as much. Yeah, so that's how you want to kind of think about there's an ease, a rhythm, grace, lightness. I think of it almost like a dancer, like a child, right? Sometimes some animals move just like they're floating, right? That's how we want to be thinking about it. From a force graph, this is what movement efficiency looks like. You get that 2x, that multiple of potential energy to elastic energy. That's essentially giving you the energy to swing that leg forward, right? And the way that you're thinking of it is you're almost like pulling a bow and arrow and you pull it back and you release it and that leg swings forward, strikes the ground, you potentiate another bow and arrow, release it, leg swings forward, potentiate, and essentially that's what we're doing. Okay? But again, it's with an ease. So it's not a jarring like pull the bow and release it, right? There's again this momentous. That's another word I did not say with the efficiency. There's a momentous component to it. And that momentous ease of movement also holds a spirality to it. There are spirals in our system. So as our leg steps forward, your opposite leg is swinging. And as that opposite arm is swinging, your leg steps forward, your pelvis rotates, your opposite arm swings forward, and your T-spine rotates. So we get these decoupling counter rotations that happen, that exist between our pelvis and our T-spine. So the art of walking is also finding the spirality in human movement. To truly, truly encompass that spirality and that efficiency, though, it starts with your relationship with the ground and with the potential energy that is coming in. It is your ability to connect to the fascial response of this sensory story. Okay, so potential to elastic energy is a fascial response. We were designed to move fascially. We as humans are designed to move fascially. And this is evident in our walking speed. So to also move efficiently with everything that we just described, you also are walking fast enough. An efficient walker is walking fast enough. Okay. And what has been shown is that as our walking speed declines, our morbidity, mortality goes up, and it makes sense. As our walking speed goes down, our efficiency goes down. We shift from moving fascially and we start moving muscularly. And we do not move muscularly when we do repetitive movements such as walking. Okay, that is a very good example of a fascial based movement. So there is a link between joint mobility, step length, and energetics of movement. You want to be able to allow this reciprocal arm swing, the counter rotation of your pelvis and your T-spine. You want to make sure that you have really good decoupling that is happening, good dorsiflexion, good big toe dorsiflexion, ankle plantar flexion, right? So we're thinking about the different joints. You have sufficient balance to take a long step. This is why I focus so much on balance and single leg stability and the link that it has to walking speed and movement longevity is because to take a long step, you have to be able to balance, right? So that is a component as well. If you start to shorten your steps, you no longer need to swing your arms. That is important, right? So if you want to be able to keep that reciprocal motion and the counter rotations of the pelvis and the T-spine, you have to take a long enough step. Okay, which means we have to have the balance and which means we have to have the joint range of motion. And then energetics is just kind of the cherry on top. And this is, can you feel the ground? Do you perceive the vibration? Can you store the vibration? Does your fascia have the potential to be elastic enough to essentially double or 2x that energy? So T-spine and pelvis mobility, really, really important to the way that we optimize our art of walking. This is going to bring that spirality that I was referring to. And if you lose that range of motion in one area, you will ultimately lose it in the other. Both the T-spine and the pelvis have to be mobilized together. Okay, together. We cannot just do T-spine mobility and think that our pelvis doesn't play a role. We have to be able to do both. Okay, T-spine and pelvis were designed to move in all three planes of motion. Okay, there is actually a video that I will be sending to everybody as part of this recording, and it's on YouTube, and it's me going through one of my favorite T-spine and pelvis mobilization, and then you can follow through and you can try it, you can save it, you can refer back to it. You don't have to refer back into the PowerPoint, but you can refer back onto that video, okay, to unlock the pelvis and the T-spine together. Okay. Now, your step length unlocks your movement efficiency. When we are thinking about this from a fascial perspective, our fascia needs to be hydrated. Our fascia needs to be elastic, and our fascia has to be sufficiently stiff. So just healthy fascia is hydrated, elastic, and stiff. It has to have kind of that capacity to it, right? When we hydrate our fascia, a huge way that you can hydrate your fascia is to move. Never ever stop moving. You want to keep moving. Lymphatics are great. Myofascial work is great. I love using vibration-based tools. Of course, I love using texture-based tools like the NeuroStick. And then here, this addresses tissue injury. So any inflammation in your body, not just from an injury, but systemic inflammation causes stickiness. We age because of inflammation, right? Inflammaging, right? So we are trying to manage and minimize our inflammation. But when we do have inflammation in our tissue, let's say the plantar fascia, that inflammation creates stickiness. And then the fibers of the fascia get tacked down, and then you go up to stand and walk, and you're essentially injuring it. So for fibers to move, they have to be not sticky, so they have to be hydrated, and there's essentially no stickiness to it. So we have to address that inflammation and the acidity. Okay, great way to do that. I love using red light therapy. Again, the myofascial work, the massage, making sure you're watching your diet, which is down here, because things like glucose, blood sugar, other foods, gluten and dairy can also do this, and it creates systemic inflammation, which creates stickiness in your connective tissue. There are different regenerative options. So if you want to look at things like peptides, photobiomodulation, systemic enzymes, growth factors, those are all really important as well for tissue injury and for ultimately movement efficiency and longevity. And then making sure that you have sufficient joint mobility. And the joints, again, that we're looking at, big toe, ankle, pelvis, T-spine. Those are the ones that we want to make sure that we hit when we are focusing on this. So as we start to pull this together, put it in a big old bow for everybody so you can start to think about this, right? Again, the intention of these free webinars is to get you curious, to get you to start to see that connection. But when we look at the art of walking is first appreciating that it is a fascial-based movement. It is a movement that is supposed to be efficient. What makes it efficient, or really the hallmark of efficiency, is connecting to your fascial system, connecting to your feet, connecting to your foot to core, making sure you have enough range of motion, make sure you perceive the ground, you can react to the ground, your fascia has enough hydration, elasticity, and tension or tensegrity. You have the joint range of motion, so you can get the spirality of gait. Okay, a lot of things of how you can start to be looking at the way you move. So what I want to do before I start answering questions is to think about little tips, tricks, or takeaways. Okay, so the ones that I would give to my patients would be, we start on the ground. Connect to your feet, wake up your feet, doing something like a neural ball release to stimulate the nerves so you can actually feel your feet. After you do that, you want to make sure that you are activating the foot muscles that actually absorb the vibration or the impact forces. That I teach through an exercise called short foot. Short foot is essentially it's a foot isometric that creates tension in your foot and connects it to your core. From there, we want to make sure all of our fascia is hydrated. Maybe you're using the neuro stick and you're addressing the fascia. Maybe you do some yoga, other mobility work, body weight work, right? Just so that you have the fascial mobility and the joint mobility. You have to be able to perceive the vibration. So look at the shoes that you're wearing. Are you wearing thick cushion shoes? Are you wearing minimal shoes? You want to make sure that you are finding and unlocking that spirality. So mobilize the pelvis and the T-spine every day. Make sure you have good arm swinging. Make sure you are doing things every day to build and support your balance. Even 5 minutes a day. We have our kinesis board. Mine is sitting right there. But this is where we have our kinesis board. So do your 5 minutes of balance exercises every day. So it is a skill that you do not lose. So you can take those long steps. And then honestly, a lot of it is getting into an environment that you can walk fast enough and that you can just leave everything down, walk with momentum. This would be what kind of a great example would be like mall walking. Mall walking is great because it allows you to take these long steps, swing your arm, right? So we're doing this movement so that we can hydrate our system. Okay, really, really great way to connect to that. So what I'm going to do is I'm going to open it up for any questions that you have. If you do want to learn more about the education that we have, please go to the YouTube channel here. You can go to eBFA Global. We will be sending information to everybody. But again, we have various certifications. We have online courses. We have a whole YouTube library of lectures. If you want to learn more about the muscle tuning theory, definitely ask that or position that. And definitely check out the Naboso products. All right. So what I invite you to do is ask any questions that you have. If you are curious about any of the concepts, how to connect it, questions with yourself, please definitely ask that. First question is, Dorothy says, is T-spine thoracic spine? Yes, I do apologize. So that would be your rib cage, right? Can your rib cage move in all three planes? And really that rotation is really, really important. Okay, but yes, T-spine is thoracic spine. So Beth asked a great question. Vibration stimulation. Can vibration plates help with this? Yes, they can. So a whole body vibration platform such as that by, let's say, Power Plate is going to mimic the ground reaction forces. So vibration plates are great for waking up your foot nerves and your myofascial system nerves, right? Waking up your feet and your foot muscles, waking up the circulation, stimulating the bones in the way that impact forces do. So it's a really, really great way to support balance, neurosensory, circulation, and bone. I love whole body vibration platforms, including something like a Power Plate. And it's just 15 minutes that you could be on there. Even if someone is not ambulatory, you can mimic the effect of walking by just setting the feet on the plate. It will vibrate and it will essentially make their nervous system and their bones and their feet feel like they walked. They got the neurosensory stimulation of walking without walking. So I highly, highly recommend vibration platforms. So efficient step length is relative to your height. So what I would say is it's a little bit more about walking speed. So the step length is what's connecting. So 2 steps make a stride. And I don't want to get lost in the weeds of the actual step length. But the way that you could tell, so this is kind of ones where it's like, are you walking fast enough that you can maintain a conversation at the same time, right? So you're kind of getting into that is when you are walking momentous, because the goal here is to try to find a momentous fascial based gait. You're swinging your arms, all your stuff is left down. You're swinging your arms. Maybe you're going for a walk around the block. You're in the mall. It's a little bit harder on a treadmill because the belt is moving. So it's not a true representation of what I'm trying to explain. But you're walking, you will start to feel like you are in this series of a fall, right? Where you actually feel that you're reaching this point where momentum is carrying you and it becomes less about effort. That's what I encourage you to find. And then when you find that, you want to connect and see how that feels, right? That's how I would focus on the step length. But even if you are thinking about speed, this whole 6 vital sign, walking speed is a 6 vital sign and how it correlates to morbidity and mortality. Just take any client, family member that you can think about, and you will start to see that the ones that start to slow their gait, you see these compounding or complementary declines in certain aspects of energy, how they breathe, they're putting on weight, maybe there's less focus, their cholesterol goes up, so right? You can see that. And then the ones that actually maintain a lot more speed in their movement and their activity, their accuracy is higher, their fall risk goes down, right? Their independence, probably their mental health and their emotional state are higher. So it's highly, highly impactful on someone's longevity. Misha asks, during mid-stance, if someone had one longer leg than the other, there's potential to trip on one's foot toe. During mid-stance, if someone had one leg longer than the other, is there a potential to trip on one's toes? And how does one adjust to roll through it? So I do want to clarify that you wouldn't necessarily trip over the longer leg. That's actually not what happens. What would happen is that your system would compensate, and you would turn your foot out, you would maybe pronate, you're going to do something in the system to try to equal out the legs. So the tripping over the foot is not that. I've never seen that. That's not how I would look at it. I would think of it as there's a compensation for the longer leg. And just so you know, we spend our contact time or our time on the ground is always longer on the longer leg. So therefore, you are exposed to impact forces for a longer period of time. So the leg that is longer is at higher risk of stress fractures, shin splints, plantar fasciitis, Achilles tendonitis, things like that. That's how I would address it. And then if you are actually suspecting a true structural limb length discrepancy, then I would see a provider. I always order what's called a scanogram. And a scanogram is a x-ray to look for the limb length discrepancy. And then I will correct through different wedging a 50% of the actual demonstrated limb length discrepancy. That's how I would address that one. Okay. That helps. Another question. What shoes are best if your big toe is hurting and possibly not using the big toe the most efficiently? I love lambs and other barefoot shoes, but cannot use them any longer. So this is one that I do recommend, rocker-based shoes. Now it doesn't have to be a Hoka with their big old stack. It does not need to be that. There's a company called Reshod. Reshod is a rocker-based shoe. It's actually a speed walking shoe. I think their website is reshod.com, but you can check it out. They are great. You can go to a shoe cobbler and take any of your shoes and add a carbon fiber rocker to it. So you can do that. Other brands are OrthoFeet. OrthoFeet is another brand that has rocker-based shoes. Of course, there are a couple other ones, Danskos, those aren't sneakers, but there are some other rocker-based shoes. Any of the super shoes are technically super shoes, meaning like a Nike Vaporfly, but they're very expensive shoes. But a 4-foot rocker is what you would do. You could also try a dancer's pad. That's a different way to offload to try to get the range of motion. And I'm happy to help in any other way if you want to kind of dive into it a little bit more. Okay. Great questions. All right. Are there any other questions? We've got about 2 more minutes. Similar to the big toe question, but with the baby toe. Tips to improve mobility and activation. I just got a pair of the Naboso Spacers and have been wearing Vivo Barefoot and Zero shoes every day. Runs in ultras. So the fifth toe is a little bit different. The mechanics are different than the big toe. So this is one less of strengthening it and realign it, especially if it is rotated and contracted, which is called a varus fifth toe. What I would say on it is to continue using the toe spacers and really practice different lever drills. There's an exercise on YouTube with a ball between the heel. Use the toe spacers and really try to lift in a clearly aligned way so that you're not straining the fifth. That's what I would do for now. You do see a higher tendency of a rotation in the fifth on an overpronated foot. So maybe there's something kind of along your foot type that you could explore as well. When you take a step, are you leaning forward slightly or are you pulling your pelvis up and tall? So I like to teach a connection to gravity. So you're not like standing like a soldier and intentionally kind of leaning forward. We do these things when we lose range of motion. So as you lose range of motion, people will actually pitch forward. You will see this in women who wear heels, is that they will start to pitch forward in the heels. And that's because they actually don't have the range of motion to walk the right way in their foot and ankle complex. And therefore, they're literally trying to just fall faster. So you're not necessarily trying to lean like that, but you do want to lift and have slight tone in your myofascial system when you are standing and moving. And a lot of that starts between your diaphragm and your pelvic floor. Um, if you are curious to learn more, I would look at like a Feldenkrais. They teach a really good fascial based movement method. So that is a good one as well. Jan says, I have a right big toe that lifts up and makes holes in my slippers. So you have essentially a hallux extensus. That means you have an issue with your big toe. So your first MPJ, which means you are rolling through your IPJ, and then you've made what's called a ski jump of your toe. That is essentially a big toe problem. So I would look at your big toe, I would do an exploration, and then that's kind of the rockers that I said, the dancer's pad. Here you can see if you have arthritis in your big toe with reduced range of motion. How do you incorporate this? Again, this is rocker-based shoes. This is dancer's pads. So there's been about 3 questions so far on that. I did do a lecture on the big toe, so I'll actually send that to everyone because we have so many questions on the big toe. There is a program through Naboso that's actually all around the big toe, so I would check that out as well. Let's see. 2 more questions. Oh my gosh. So now there's more questions. Oh my gosh, you guys. Can you use vibration plates for people who have had blood clots or an embolism? I would only do that once they're medically cleared. But using a vibration platform consistently can decrease blood viscosity, meaning making it less sticky. And then that could then decrease someone's risk of clots. So that's how I would think of it. So for the getting in touch with me about any of these questions, dancer's pad, rocker shoes, big toes, arthritis, go to my website, dremilysplichal.com, and please contact me through there. Okay, let's see. I'm going to answer 2 more questions. Everyone, thank you so much for hanging on. Eileen says, I love to walk fast, or I like to walk fast, but I tripped and had a bad fall. Now I have no walking confidence. This totally makes sense. And is a big thing that I focus on is walking confidence, movement confidence. And when we start to lose our confidence, it is a very strong predictor of future falls. So, Eileen, we have to get you confident in your movement again. I would say it goes to your connection to the ground. You have to feel your feet, feel the ground, and I need to improve your balance. Those would be the 3 things that I would focus on. This is not one where I would say you walk more to get more comfortable walking. That's not how I would approach this, Eileen. I would make you feel really grounded and safe in your feet. I would want you to feel very grounded and safe in your balance. You can message me through my website and I can send you some of the programs directly. But just so you know, okay? Last questions. I walk in barefoot shoes with the Naboso inserts, but because of my really bad knees, other shoes make me feel that my legs rotate and my knees hurt worse. I assume this will change with knee surgery coming up soon. I would still look at and try to do after knee surgery. You want to feel the ground even more. After ankle arthritis, or if you have ankle arthritis, a knee replacement, a hip replacement, any of that, you have to reestablish your sensory connection. You have to feel the ground, you have to feel the joints, you have to feel the impact. It's really all about this connection. And I know I say it a lot and I feel like just repeating a lot of it, but it is so important. Even here, this question on neuropathy and how to balance in non-padded shoes for comfort walking it's about feeling your feet, connect to your feet. That's part of why I developed Naboso, so people could feel their feet easier. So do the exercises in our socks, do the exercises on our mats. I would use a vibration platform. I would release your feet. I would do our balance exercises. I would really get into your toes, use toe spacers if you need. We do have a program all about brain-based balance training. I would incorporate that. But these are such great questions. So I really appreciate you guys asking your questions. What I would say as we wrap up, I wish I could answer more, but as we wrap up is what we're going to be doing in 2026. So depending when you're listening to this, what we're doing in 2026 is that we are actually going to be doing a lot more of getting engaged with me, live with Dr. Emily, ask me your questions, come on as the client or the member, the patient, the lay individual, right? The non-clinician, and come on, ask those questions. I want to make sure that you understand the neuromas, the balance issues, the arthritis in the big toes, whatever your questions are, we are here to help you really understand your body and the way that it's presenting. So please look for that coming in 2026. Our first one's going to be in January. We're going to do that once a month. They will be theme focused. So we'll probably most likely start January as big toe. So bring all your big toe questions, and that's what we're going to dive into. So stay tuned for that. This recording is going to be up soon. Everybody's going to get an email with that recording. And if you have more questions, please reach out to me directly through my website, dremilysplichal.com. It was up on there, or you can just search my name, Dr. Emily Feet. You'll get it. It'll come up to you. And then, of course, the Naboso products. And we are here to help you understand your body even more. So I appreciate your guys' time. Have a wonderful day or evening, depending when you're listening to this recording. And we will see you soon. Take care.